Are you unsure of what's causing your hip pain? In this video, I'll quickly run through the different symptoms you should look out for related to hip arthritis, hip bursitis, hip injuries and fractures, and hip impingement. So, let's get into it. I'm Simon Garrett, a specialist hip and knee surgeon at the Winterbourne Hospitals. Having hip pain can often feel quite scary, particularly if it's affecting your ability to walk and go about your life with ease. By far the most common cause of hip pain that I see is arthritis. Arthritis is essentially wearing away over the normal smooth cartilage inside the joint, so it becomes roughened and you end up with bare bone on bare bone. That's extremely painful and causes stiffness in the joint. The most common type of arthritis I see is osteoarthritis. Patients will typically know they've got that if they have a deep-seated ache in the hip, often described as like toothache, but also causes stiffness and makes every aspect of their daily life very difficult indeed. Generally, osteoarthritis will affect one or two joints in isolation, whereas rheumatoid arthritis is a condition that affects the whole of your body and multiple joints at one time. We try to treat the symptoms of arthritis in the hip through a variety of means, starting with very conservative approaches using physiotherapy and painkillers, but as the symptoms increase, we can use injections, but ultimately, once the pain and suffering becomes too great, often hip replacement is the only option. Hip bursitis is typically caused by inflammation of the bursa over the side of your hip, but often this is confused with another condition of tendinitis affecting your main walking muscles. The bursitis is caused by inflammation over the side of your hip. That causes pain and swelling and therefore disability in terms of your activity, especially pain on lying on that side. Bursitis typically comes on spontaneously without any particular cause. Much more common in females than males, and it can be exacerbated by an abnormal walking pattern such as a limp. Bursitis is often confused with tendinitis, although the similar symptoms, the treatments often vary quite remarkably. Patients with tendinitis will feel often a burning sensation, especially when walking. Bursitis is treated very similarly to arthritis. We try to start off with more conservative methods of management, including physiotherapy and painkillers. If the symptoms don't get better, you can have a steroid injection, although we wouldn't advise many of those. And in my opinion, surgery really is never indicated. Hip injuries are actually incredibly rare, especially when compared to the knee. If a patient does fall over and hurt themselves or damage their hip, it's often a fracture or something serious that would need urgent treatment. Hip fractures are treated very differently to those other chronic conditions that we've been discussing, and it's something that I rarely see in my day-to-day practice. Hip impingement is essentially a condition that affects younger patients. However, it's caused by the fact that your ball and socket of your hip joint don't really fit together properly. It then goes on to cause damage to the cartilage around the edge of the socket typically. Symptoms of impingement are often quite classic. Patients describe as sharp, catching, stabbing pain, typically deep in the front of the joint or in the back, when patients will often say it feels like a red-hot poker going straight through the joint. Like a number of our other conditions, hip impingement is treated with physiotherapy. If physiotherapy and painkillers have failed, then sometimes surgery is required. This is in the form of keyhole surgery. And what we attempt to do then is to shave back abnormal areas of bone, make the ball and socket fit together better, and then try to repair any damage to the cartilage. These are just a handful of the possible causes of hip pain. If you're still unsure as to what your hip pain might be, it really can be helpful to have a specialist look at your hip and run some tests. To come and see me for consultation, you can book online via the link in the description below this video, or to search for your local Circle Health Group hospital, go to circlehealthgroup.co.uk. If you want us to make videos that take a deeper dive into any of the treatments or underlying hip conditions we've mentioned today, then please leave a comment below this video so we know what kind of videos you want us to make in the future. But until next time, thanks for watching.